gamma radiation is no laughing matter, and you're absolutely covered in it. How did this even happen? Did you go towards an explosion? Or, don't tell me, don't tell me, did you happen to get in the way of Hulk and the disgusting man Namor's brilliant idea to put gamma radiation on marine life? Of course. What imbeciles. No, I'm afraid you cannot leave. Not until I figure out what's wrong with you. I'm afraid to say we cannot have another Hulk situation on our hands. And that's nothing against Bruce. Bruce is a lovely man. But let's just say one Hulk is already enough. I don't think I could forgive myself if I just let you go out and destroy something. And I don't think Bruce would ever forgive me either. But rest assured, you are safe here in the Baxter building. Relatively. That's not to alarm you. If you would have asked me about a week ago, I would have a completely different story to tell you. Last week, we were under attack from vampires, which was entirely unwanted and highly unusual. This week, however, fingers crossed, nothing's going to attack us, so you can relax as much as you can. Though the tests I'm going to be putting you under are not really meant for relaxation. But I don't know, I've been wrong before. Not often, but wrong. You could find them quite relaxing, which is exactly what I'm here to figure out. Also, just be thankful that it's me doing the tests and not Reed. I do adore that man, but Mr. Fantastic is not known for his bedside manner. Even with 4 doctorates in biochemistry, I can still not make heads or tails of anything he says. At least here. I'll try to put it into plain speak. I wouldn't want to rile you up for no reason. I want to put you at ease and make sure that you're not going to turn into a green raging monster. Or something worse. So, please answer truthfully while I get your information, get your vitals, and also during the tests, it is quite important that you are honest with me, alright? Wonderful. Okay. Let's first start off with your name. What is your name? Okay. Perfect. Okay, and your age? Okay. All right, and your blood type, if you don't mind, if you know it, that is. Interesting. Okay, now this might come as a bit of a personal question. Have you ever been known or been referred to as a mutant? No, there's nothing wrong with mutants or mutant kind. I actually know quite a few lovely mutants and quite a few not so lovely mutants. But it's going to help us get a read on Any developing abilities, if we know if you had any previous abilities. Okay. That's fine, it's fine. Again, honesty is exactly what we're looking for. So, can you tell me about any past medical history? Any abnormalities or chronic conditions? No, literally anything. Migraines, asthma, eczema, abnormal heartbeats, anything. Okay. This is just to see if there's any changes to any of these medical issues. Speaking of any medical issues, any medications that you are currently on a regular basis? Any vitamins or... Okay. Anything else? Okay. Perfect. Was that it? Okay. No, that's perfectly fine. It's important to take care of your health. Okay. Perfect. Now, I know you were only recently exposed to not a insignificant amount of gamma radiation. Have you noticed any peculiar changes? Changes in your mood, changes in your appearance, any abnormal growth of the hair or fingernails or anything? Change of eye color, changes in sense of smell, anything that feels or seems out of the ordinary? Not yet. Interesting. From what I remember about Bruce, it was pretty quick, but depending on who you are, your body chemistry, all of those things can be different or change. Interesting. No, I'm afraid that doesn't mean you get to leave, even if you're feeling right as rain right now. Trust me when I say, if anyone knows what it's like to change based off of radiation and wake up completely new the next day, it's us here in the Baxter building. Myself included. I mean, do you think I was born being able to become invisible? Unfortunately not. It was something I had to learn and grow and adjust to. I mean, I would hate it if I sent you on your way and you woke up and you were a completely new person. What if you woke up and suddenly you were rocks? I mean, I'm just not trying to make light of the situation. It can take a lot out of you emotionally and physically and mentally. Poor Ben. Not that there's anything wrong with being turned into rocks, it's just, it was a big adjustment period for Ben. And I don't want you to go through that alone if that ends up happening to you. Not that I'm saying you're going to turn into rocks, but there is a small chance. We don't know what the gamma radiation is going to do to you. But let's first begin with taking your vitals, okay? Okay, perfect. Hold on one moment. All right. Are you comfortable with me attaching you to a few wires? I promise it's not going to hurt. Okay. Just big deep breath, try to stay calm. I want all the vitals to be relatively in order, hopefully. So that means no irregular heartbeats, no quickening of the pulse, just relax, okay? So I'm just going to gently push that there and stick something right here. Perfect. Can you shake your head from side to side for me? Make sure they're not going to fall off. Okay, perfect. Okay, and can I see your arm? Thank you. Okay, I'm just going to gently attach some of those right there. The other one too. Let's just attach a few notes over here. Perfect. Perfect. Okay, can you shake your arms gently for me? Gently. Okay, good. Nothing's gonna fall off. Let's start seeing some of your vitals. Interesting. And you said you haven't noticed any drastic changes or even minor changes. Okay. I don't want to alarm you, but you have quite an irregular heart rhythm. And you didn't say you had any heart problems, correct? Okay. No, it's quite strange. First it's going fast, and then it's going slow, but you're not noticing anything going on here, right? No, okay. I'm just going to gently place my hand on your chest, and I want you to take a few deep breaths for me, okay? Okay, perfect, all right. Now we can do it together. In, and then out. Okay, one more time for me. In, and then out. Okay. That is still going on. Alright, that's something we're gonna have to keep track of. You didn't have any issues breathing or any difficulties feeling like air is being trapped anywhere, held anywhere? No, okay, good. And to your knowledge, everything is sounding relatively normal. You don't, for instance, hear something a few miles away or in the next room. You don't hear a fly buzzing. No, okay, perfect. And visually, do I look okay? You don't see 2 of me or 3 of me. You're not able to see with infrared or anything. Okay, good. And this is your natural eye color, correct? Okay, it is. Perfect, alright. And you haven't noticed any uncontrollable issues with your emotions, controlling them, understanding them? Anything out of the ordinary? Besides being nervous about being tested. Well, that happens to the best of us. But I promise you're in very good hands. Again, I don't have 4 doctorates for nothing. Your brain waves seem to be relatively steady and normal. So I don't think you're lying about that. But I want to see how you react to certain stimuli. See if we can get a rise out of you. See if maybe one thing might trigger a green monster from you, or something worse, or something better. Once I figure out exactly the situation, let me assure you, those responsible are going to get a very stern talking to, and maybe a smack or two. Let's just say Namor and I are not on the best of terms. If anybody ever wanted to check and see if I would turn into a giant monster, all they would have to do is show me a picture of him and his disgusting feet. I don't like him. But that is a story for another time. You are not here to listen to my problems. We're here to focus on you and figure you out. Now, I know this is going to be quite unorthodox, but do I have your permission to pinch you? I understand that's not something a doctor would normally ask you about unless they were giving you a shot, but I assure you, I just want to see if this is going to bother you enough that we might see a metamorphosis between who you are right now and who you might become. Of course, if it gets too painful, I am more than happy to stop, but maybe just a few. Okay, thank you. All right. So just hold out a hand for me. Perfect. Okay. And now I'm just going to pinch. Anything? No? Okay. Pinch. Anything? Okay, what about on this side? Other arm? Pinch. No? How about now? Pinch. Nothing? Are you sure? Okay, what about over here? Just going to gently pinch around. No. Okay. How about over here? Just going to gently pinch. Nothing. Interesting. Okay, maybe pain is not a stimuli. I know, okay. I know quite a few people are not very fond of tapping. They find it quite bothersome. Maybe I can see if that's going to annoy you, bother you. Okay, hold on one moment. I'm just gonna gently tap and you tell me if you find this bothersome. Anything? No? Are you sure? Nothing. Interesting. You actually find that quite relaxing. Huh. Well, that's the opposite of what I wanted. You don't feel any changes or anything? Fascinating. Oh, I know. Quite a lot of people don't like mouth sounds. Why don't I do a few for you and you just tell me if that's something that really bothers you? Okay? Okay. Nothing. Are you sure? That really drives Johnny insane. Okay, one more time. No. Not bothered by that at all. Okay, let me write this down. Okay, first test failed. Pain, not a stimuli. Second test failed. Enjoyed the tapping. Not bothered at all. And third test failed. Joy's mouth sounds. Quite interesting. Well, this is going to be a lot more difficult than I thought. I know. Colors. Certain colors generate responses from individuals like anger, happy, sadness. Why don't I show you a few colors and you just tell me if they give you an emotion, any emotion, preferably a strong one, hopefully negative, so we can see if you're actually going to turn, or maybe you'll just stay as you are, which isn't a bad thing. Again, we're trying to minimize the risk of you accidentally hulking out. Wouldn't want that. Now would we? Alright. Are you ready for your first color? This one's going to be quite bright, but you just let me know how it makes you feel. Anything negative or positive. And I'm going to watch you and see if you exhibit any changes. Okay. Perfect. Alright, I have yellow. A very bright, bright yellow. Do you feel any different? I don't notice any visible changes, but you don't feel anything? Okay, not to fear, I have more colors. What about black? Quite a moody color. Some people are afraid of the dark, spooked by their own shadow. Any changes? Not that I see. So let's take a look at your heartbeat. Oh, I'm starting to think you find this way too relaxing. Okay, let's try the next color. A bright and passionate red. Anything? No. Stir any emotion? You enjoy the color red. Okay. Not really what I was going for, but let's test a few more. How about this one? An orange. I'm not very fond of this color. It's making me slightly anxious. What about you? Any changes on the monitor? No changes on the monitor, okay. Any changes in your appearance? No. Just me. Okay. Will you permit me to test maybe one or two more? I'm sure I have to have something. This is quite another strong color. Magenta. Very bright. Obtrusive, maybe? Any changes? None whatsoever. You find the sound quite pleasant. That explains the heart rate. Oh, back to square one then. Are you sure? Nothing? Oh, you're more relaxed than when we started. Okay. I have one more test for you. This one should be quite different from the others, but I promise no more pinching. Oh, I hope something happens. Let's see. Okay, I have a nice soft brush for our next test. We're going to see if this evokes an emotion within you. See if this causes any irritation frustration. Maybe you'll find it relaxing like the rest of my tests. If this doesn't work, I think I'm gonna have to bring Johnny in here. He's quite annoying. Don't worry, it's just my brother, Johnny Storm. I've yet to meet somebody who finds him and his company pleasant, so if all else fails, I still have that going. Hold still for me, please. Just gonna gently brush. Anything? No? Okay, what about over here? Anything? No? Okay, what about along your forehead? No? Okay, how about down your neck? Anything? Any changes? Oh my goodness, I think this might be the most relaxed I've seen you. Okay, what about over here? Down your neck? It's having the opposite effect. Oh no. Okay, what about if I add a bit of extra stimuli? See if we can get any changes here on the monitor. As I gently brush you, I'm going to maybe name a few people you may or may not be familiar with, and we'll just see if that gets a reaction out of you. For instance, if somebody said Namor, the Unloved, I think they would see quite a lot of anger from me. Physically, mentally, emotionally. I hate him. Okay, so we'll just see, and you just let me know, okay? Right, I'm just gonna gently brush and say, Penny Parker. Penny Parker. No, okay. What about here? Thor Odinson. Thor Odinson. Nothing. Okay. Cloak and dagger. Cloak and dagger. Cloak and dagger. Anything? No? Okay. What about Black Widow? Black Widow. Black. A little bit. Oh, you just find her very pretty. I can understand Natasha is very pretty. But nothing else? No anger? Okay. What about Wolverine? Wolverine. Wolverine. No. Okay. How about T'Challa? T'Challa. 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 Nothing. Emma Frost. Emma Frost. Emma Frost. Emma Frost. Nothing. Oh, I know this. This has to get a reaction out of you. It gets a reaction out of everyone. Okay. Hold still, and I'm sorry for what I'm about to say. Spider-Man. 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 A little bit. Is that irritation I see? I mean, Peter's a lovely boy, but I can say he is a bit frustrating when it comes to staying in one place, huh? Well, didn't really pan out how I was hoping. I guess it's time for Plan Z. I'm so sorry I have to do this too. But unfortunately, you're going to have to stay here for a little bit longer. though, if you feel the need, you can take a nap while I go and hunt down that lovely brother of mine, but unfortunately I'm going to stick you in a room with Johnny Storm and see what happens. I wish you the best of luck, so maybe relax while you can. So again, I really didn't want this to come to such dire straits. Well, you sit tight, and I'll be back. And if you end up changing or notice any abnormalities, take note of them right here, okay? Hopefully I won't be too long, but knowing Johnny, I don't know where he is. I never know where he is. You sit tight. Johnny, where are you?